My friends, now let's take up another topic as a functional anatomy of teeth. So, teeth are accessory organs, accessory tissues, hard tissues in alimentary canal. These are highly helpful in food mastication, food incising, tearing, cutting, and grinding of food. So, let's start with the introduction. Teeth are highly calcified tissues, hard tissues of the body. These are embedded in upper jaw and lower jaw. These are embedded in specific pockets in upper and lower jaw. Those pockets are called sockets. Like if it's a crown part and it's a root part, this root part is embedded in a jaw, and this is a bone part, and this depressed area of the jaw is called socket. These are the pockets in jaw. So these are embedded in sockets which are called alveolar sockets. So these are meant for cutting of teeth, tearing of teeth, cutting of teeth, or incising is the function of incisors. Tearing of teeth is a function of corner teeth or canines. Then mastication or grinding of teeth refers to converting the large size food particle into small size food particle. This is the function of mastication or grinding, and this is performed by premolars and molars, because these two teeth have wide table onto which food particles rest, and these are constantly ground or masticated. So where the teeth are located? These are located in alveolar portion of maxilla and mandible. The portion of maxilla and mandible which house teeth are called alveolar processes. In each alveolar process is an upper alveolar process. The maxilla has depressed area or pockets where teeth are embedded. So alveolar processes and alveolar sockets are 2 points which you need to remember. Alveolar processes are the surfaces of jaws having teeth, and teeth are embedded in pockets in alveolar process, that is alveolar socket. Remember 2 words. Now next part, boundaries, anterior teeth, central incisor, posterior teeth, molars. Now just leave it. It's a macroscopic anatomy of a tooth. Macroscopically, when we define anatomy of a tooth, we have a macroscopic and microscopic aspect. Macroscopically, a tooth has 3 parts. It can be any tooth, incisor to molar. It has 3 parts. Say it is the first part of a tooth. This part of a tooth which is visible in oral cavity. This part is called crown. And this is a narrow part which called neck, which connects the crown with the root, and this part is embedded in alveolar socket in a jaw. This is called root. So crown, neck and root are macroscopic 3 parts of a tooth. Crown, neck and root. Then this is macroscopic, and microscopic I will discuss in the next slide. Before that, let's look into the types of teeth. Teeth are 4 categories based on their structure, based on their function. These are incisors, 4 upper incisors, 4 lower incisors. Each incisor serves for cutting or incising a tooth, like biting an apple. Canines, they are the corner teeth, 2 canines upper jaw, 2 canine lower jaw. Canines are meant for tearing a food particle, like fibrous food particle which can be teared. Canines are most prominent in carnivores. And then comes premolars and molars. These teeth have, just I said, they have broader occlusal surfaces. Occlusal surfaces mean say it is a molar. So this surface is called table of a tooth, or upper surface or occlusal surface of a tooth, where food particle rest and it is chewed, it is masticated. When opposing molar comes in contact. So the food particle is crushed between the top of upper and lower molars. So these are meant for grinding or grinding or this mastication of food. So these are the types of teeth. Then comes sets of teeth in human body. A human have two sets of teeth. First set is called deciduous teeth. Deciduous teeth, or these are called milk teeth. These are 20 in number. And second, permanent teeth. These are 32 in number. So first deciduous tooth appears at the age of 6 months, and complete eruption of deciduous teeth 20 is completed up to the age of 3 years. So first permanent tooth erupts at the age of around 3 years. And one thing more I would like to share with you, there are 3 molars, 3 types of molar. First molar, second molar, and third molar. So how many molars? 12 molars. 6 molars upper, 6 molars lower. They can be categorized into, depending on age of eruption, first molar, second molar, third molar. First molar erupts at the age of 6 years. Second molar erupts at the age of 18 years and 12 to 18 years. Sorry, make it second molar erupts at the age of 12 years, and third molar erupts at the age between 18 to 21 years. And third molar is called wisdom tooth. So this text is important, whichever I am discussing with you, important to solve one sentence questions and multiple choice question. The third molar is called wisdom tooth. Let's see what are the parts with the tooth. Histologically, I discuss with you macroscopic parts of a tooth: crown, neck, and root. As far as microscopic anatomy or histology concerned, any tooth has following parts. The outermost part of the tooth is called enamel. Below enamel lies another hard part, dentin. Dentin is the hard part over only crown portion. Second hard part. And cementum is the hard part, second hard part over root. So repeat, enamel is the hardest part of tooth, and dentin, enamel is present always on crown part. Hardest part of a tooth. Dentin is the hard part of a tooth, only next to enamel on crown. Cementum is the hard part of a tooth, next to enamel only on root. And enamel, dentin, and third part of histologically is the pulp of a tooth. A pulp of a tooth is present in the innermost part of a tooth, immediately next to dentin. So this pulp is a soft tissue. Pulp contains fibers, pulp contains cells, and pulp contains blood vessels and nerve fibers. So it's a soft tissue of a tooth. So if we look at this diagram, say this is the crown part, narrow neck part, and it's the root part. This is the yellow color depicted is the bone. And this two roots, this is a molar. Two roots are embedded in a socket. And this red portion between this part is cementum, and this part is bone. Space, that is reddish line, is the space between root and bone where fibers are present, which I discussed with you in my previous slide. These fibers are called periodontal fibers. So this pink colored portion is the gums. So this white part is the enamel. So this light brown or yellow part is the dentin, and this white part over here over the root is cementum, yellow part again dentin, and this reddish part in the center of a tooth, either crown or root, is this part is pulp. So histologically, parts of a tooth: enamel outermost, dentin second layer, and pulp is the innermost layer. In root, enamel outermost in a root part is cementum, dentin, and pulp. Enamel, dentin, pulp, crown. Cementum, dentin, pulp, root part. And two points I will share with you. Enamel, most important point, enamel is the hardest tissue in human body, much harder than bone. You would be astonished, surprised. Enamel contains 97% hard part, and plus it contains only 3% soft part, that is organic part. Its 97% is inorganic part or calcified part, which is called hydroxyapatite crystals. Hydroxyapatite crystals. These are the crystals of calcium and phosphorus. So enamel contains 97% calcified part, only 3% organic part. If I compare it with dentin, compare it with cementum, and compare it with bone, so approximately I would say, not accurate, approximately I would say, these three hard tissues, they contain around 60 to 70% calcified part, that is hydroxyapatite crystals, and around 30% organic part. So you compare 97% hardest part is only in enamel, so I would quote, enamel is the hardest tissue in human body. Again, one more point, enamel is avascular, doesn't have any blood supply, so it is non-living portion of a tooth. It is always protective in nature. Let's see the next slide. Functions of teeth, just we discussed, has every function: cutting, tearing, mastication, grinding, speech articulation, and also teeth, when embedded into the jaws, they provide strength, mechanical strength to the jaws. In the absence of teeth, jaws become edentulous. That is a jaw, mandible, or maxilla without teeth. So those jaws are more prone to fracture. Then let's discuss applied anatomy of teeth. First one is dental caries. It is a microbial disorder. It is the demineralization, it is the decomposition, destruction of a tooth, causing pits and cavitation and pain. Then gingivitis and periodontitis, inflammation of gingiva and periodontal structures. This one part which is to be discussed is malocclusion. What is occlusion? Occlusion means when upper and lower arches, upper and lower teeth, they fit into each other properly, that is occlusion. So, but when the upper and lower teeth, they are in contact with each other, but some of the teeth, they are out of the alignment, then we call malocclusion. So malocclusion is misalignment of the teeth. Let me see if I have a diagram, so I would be able to clear. Yes, this is a malocclusion. Yes, see, these incisor, lateral incisor, here canine is missing. So canine is placed in the jaw, is erupting. So this upwardly placed canine, it disturbs the normal alignment of teeth. This is malocclusion. In the lower arch, this is placed on one side, is not in alignment. So this type of arrangement of the teeth, either in upper arch or lower arch or both together, constitute malocclusion. Yes, this one, another the disorder affecting teeth. You just notice over here, this is the first molar of mandible. This is the second molar mandibular, and let's see where the third molar is present. Third molar erupts between 18 to 21 years. When it erupts, all the teeth have taken space in dental arches. The space left for its eruption into oral cavities is decreased, or there may be additional factors. So the third molar doesn't find adequate space to erupt into oral cavity, so its eruption, its growth become arrested. It remains inside jaw, although it is fully formed, and this condition is called impaction. Impaction refers to arrest or restricted eruption of a third molar, specifically third molar, mostly affected third molar into the oral cavity. So then it is treated surgically. Another disorder which is highly prevalent in a population, that is tooth hypersensitivity. This is the most common finding which day to day the patients thus narrates with the dentist. So how does it manifest? Hypersensitivity means, suppose a person which consumes anything very hot or cold like a cup of tea or an ice cream, when it's take up in the mouth, one feel sensitivity, one feel pain. Or whenever a highly concentrated edible containing high quantity of carbohydrates, like anything sweet like table sugar, or anything bakery product containing high quantity of carbohydrate with high osmotic concentration, take up into mouth, again one feel pain. So these characteristic features of feeling of pain, feeling of current after intake of anything hot, cold, or highly with the high osmotic concentration edibles. So this symptom is called tooth hypersensitivity. Why hypersensitivity? Before that, let's see the diagram. In this diagram, this part is enamel, and this entire part is dentin, and this part is pulp, which contain nerve fibers. So one thing I would like to additionally share with you, dentin, in its entire dentinal structure, the dentin contains narrow channels. Say its outermost, this is a crown part, this is outer part is enamel, and if I select another color, if I select another color for dentin, so this is dentinal part, and again this is a pulp part. So this is a dentin. The dentin contains very narrow channels. These narrow channels, as these are shown over here, these are called dentinal tubules. And these dentinal tubules, they contain nerve fibers. The nerve fibers are the projection of odontoblast. So these are odontoblasts. They lies in pulp. They give rise to finger-like processes. They run in dentinal tubules, and they are surrounded by fluid inside dentinal tubules. This is a normal structure of dentin. So how this structure is deviated, how it is diseased, causing hypersensitivity? If overlying protective enamel is eroded, damaged, dentin is atreated, that is loss of dentinal layer, then it leads to exposure of dentinal tubules to oral environment, oral cavity. So when anything hot or cold or highly concentrated edible taken into mouth, it touches the odontoblastic processes, nerve endings, and it disturbs the movement of fluid inside dentinal tubule. That generate pain, that generate hypersensitivity. So this is treated by several anti-sensitivity paste. The most prominent compound is potassium nitrate. There are several compounds which treat hypersensitivity. This potassium nitrate, it blocks the dentinal tubules and prevent hypersensitivity. Let's see the next slide. This is impaction, which I told in my previous slide. Yes, this is another important disorder affecting enamel. There are two terms are there. One is enamel hypoplasia. So another term is enamel hypocalcification. Let's see the difference between the two terms. Then we can understand manifestation. Enamel hypoplasia. Hypo means less, plasia means proliferation. So this is characterized by reduced organic matrix formation in enamel. This leads to reduced thickness of enamel. Further, in this condition, calcification, I said any hard part is formed by two processes. One is organic matrix is laid down. Then organic matrix further undergo calcification by deposition of hydroxyapatite crystals. So in enamel hypoplasia, the cells which lay down organic matrix of enamel, they are called ameloblast. These cells deposit lesser amount of matrix, enamel thickness become less, but calcification of enamel, that is normal. In hypocalcification, in this condition, organic matrix formation is normal. It is normal. Enamel thickness normal, but here defect lies in calcification. There is reduced calcification, reduced hydroxyapatite crystal formation. This means enamel become highly weak. So what are the clinical manifestation? Enamel hypoplasia, as this diagram you can see, there is a brown pigmentation over the surfaces of teeth. This is a brown pigmentation, yellow to brown pigmentation. Second, you see in a labial surface of tooth, there are deep grooves. So these are called pits. So yellow to brown discoloration and formation of pits are characterized by hypoplasia. And hypocalcified teeth are manifested by presence of shock-like white patches on surfaces of teeth. That is a feature of hypocalcification. Brown to yellow, yellow to brown discoloration, and pits are feature of hypoplasia. And these teeth require conservative treatment. Now we discuss functional anatomy of another organ, that is primary organ of alimentary canal, that is pharynx. Pharynx is a thin muscular tube. It lies next to nasal cavity, that is nasopharynx, and it lies next to oral cavity, that is oropharynx. Nasopharynx leads to oropharynx, and oropharynx then descends into laryngopharynx, which enters into esophagus. So these are the three parts of pharynx and their continuity. So it is a funnel shaped part, and it is a length of around 15 centimeter. If we compare it with esophagus, that's also a thick muscular part that is broader in comparison to pharynx, and the length of esophagus is around 25 centimeter, whereas the length of pharynx is around 15 centimeter. So what is the role of pharynx? Pharynx serve as one passage of air and passage of food. So it is a serves two purposes. It serves as a passage of air, that is the part of pharynx which lies behind the nasal cavity, behind the internal nares. That part serves as a passage of air. So air from internal nares goes to nasopharynx, then goes to oropharynx, laryngopharynx, then into larynx. But food from oral cavity enters oropharynx, laryngopharynx, then into esophagus. So it serves for air and food. It also has a role in respiration, swallowing, and speech. And its a location. It extends from the base of skull to the level of C6 vertebra, and it communicates inferiorly with the esophagus. Now let's, with this diagram, understand the parts of pharynx. We see this diagram. This is a frontal sinus. This is a nasal bone, upper jaw, lower jaw. It's a mandible, ramus of mandible. And this upper jaw, and this is the hard palate, soft palate, and uvula. Regarding this is the nasal cavity, nasal bone, frontal sinus, sphenoidal sinus. And regarding nasal cavity, this is superior concha, middle concha, and inferior concha. Bony projections in the nasal cavity. These three conchae then posteriorly terminates into, this is the opening of eustachian tube, artery tube, which connects the nasal cavity with middle ear. It equalizes the air pressure. So behind this opening of eustachian tube, this part is called, this is the, I have just highlighted, this is the nasopharynx. This part is called tongue. This is hard palate, soft palate, uvula, and this space is the oral cavity. This part is the dorsum of tongue, and this portion is the oropharynx, and this part is the laryngopharynx, and this is trachea. This laryngopharynx then continues into esophagus. This is the parts of pharynx. Histologically, microscopically, nasopharynx, it lies respiratory epithelium. Respiratory epithelium is pseudostratified, columnar, and ciliated epithelium. It's a respiratory type of epithelium. Oropharynx and laryngopharynx. So these two are non-keratinized epithelium. Nature of epithelium, it is stratified and squamous epithelium as in oral cavity. So it's a protective in nature. It maintains the size and shape or a lumen of pharynx. And remember, pharynx always contain skeletal muscle, like the oral cavity, like the tongue, which contains only the skeletal muscle. The skeletal muscles are arranged into two patterns of arrangement. One is circular pattern, and another is a longitudinal pattern of arrangement of skeletal muscles. The circular skeletal muscles, they are present outer part of the pharynx wall, and longitudinal pattern of skeletal muscle, they lies in the inner wall, inner side of the wall of the pharynx. Then comes the function of pharynx. It serves as a passage for the air, passage of air, inhalation. During inhalation, air carries oxygen, so it provides as a passage for the inhalation, for the movement of air from atmosphere to the respiratory tract, whereas it also provides a passage for the movement of food from oral cavity to esophagus and stomach. It also helps to equalize pressure between middle ear and nasal cavity through eustachian tube. And one more thing, important part, the pharynx contain tonsils. Tonsils are the patches or the cluster of lymphoidal tissue which provide localized immunity. Regarding applied anatomy, first is pharyngitis. Pharyngitis is the inflammation of the mucosa or the wall of pharynx. When mucosal epithelium get inflamed, we call pharyngitis. So pharyngitis can be caused by bacterial infection, and the causative organism in bacteria, it may be Staphylococcus, and they may be caused by influenza virus A and influenza virus B, and there are another causes of pharyngitis. So another disorder affecting pharynx is the pharyngeal tumors. These tumors, they may cause obstruction if they occur in the nasopharynx towards the inhalation of air, difficulty in breathing, and tumors may be in oropharynx, and these are called nasophryngea carcinoma. This is common in certain geographical areas. And dysphagia, this means difficult, phagia means swallowing or eating. So when the swallowing of food, it becomes difficult, this dysphagia may be due to obstruction in the oropharynx, can be caused by tumors. So this is dysphagia. But dysphagia has certain additional causes, which we will discuss in the coming slides. But here dysphagia refers to difficulty in swallowing, which may be due to tumors in the lumen of pharynx, which obstructs swallowing. This is a clear picture of inflammation and enlargement of adenoids. Let's see what the adenoids are. Adenoid, let's see in the picture, is a nasal cavity, superior, middle and inferior concha and myotices. Here this is somewhere eustachian tube opens up, and here the nasopharynx starts. So this is the adenoid. This is the in fact this is the enlarged adenoids. Otherwise, adenoids are lymphoidal tissues in the nasopharynx. Nasopharynx behind opening of eustachian tube. These adenoids are the source of immunity, localized immunity, and these adenoids are present in children and present in children up to the age of 12 years. Thereafter, normally adenoids atrophies and it degenerates by the end of puberty. In adults, adenoids are absent, but in case it is a normal process. But in case in children, by any cause, adenoids are inflamed, and a repeated inflammation of adenoids leads to their hypertrophy, enlargement and size. When the size is enlarged, then definitely they obstruct the inward movement of air, inflow of air. So the child with inflamed and hypertrophic adenoids, they feel difficult by breathing by nasal cavity. So such a affected child during sleep resort to snoring. Keeps mouth open because breathing by nose or nasal cavity is obstructed, and the child take to breathing by keeping the mouth open during sleep. And such affected children, they have a typical faces. This is called adenoid faces. So this is adenoid hypertrophy. So another disorder affecting pharynx is tonsillitis. Tonsillitis is the inflammation of tonsils, predominantly palatine tonsils. Tonsils are the similarly lymphoidal tissues present in palate, present in posterior 1/3 of the dorsum of tongue. So this diagram shows this is an inflammation of tonsils on the right and left side. These create a difficulty in swallowing, pain in throat, fever, and other additional associated manifestations. But in some cases, repeated tonsillitis, repeated episodes of tonsillitis may gets into further complication, and there is a formation of pus that is called peritonsillar abscess. Yes, this diagram shows peritonsillar abscess. It's a complicated, this is a complication of acute tonsillitis. Here you can see Tongue is depressed with the wooden this spatula and showing clear picture of uvula. These are the inflamed tonsil, infected tonsil with accumulation of pus. This is called quinsy.